So you think you've come to the place to where your loved one is going to need more care than you can provide or get for them in the home setting. So now you're looking at different places that may be able to provide for him. One of those places is a skilled nursing facility. I'm sorry for that because it's a really hard time. I know I had to go through that with my dad. But I do want to take just a few minutes and help you to understand the goal of this video is to help you to determine what is going to be the right type care for your loved one and to help you navigate some of this confusion, fear, and honestly, even guilt. And helping you to understand that this really is an act of love. It's an act of care to make sure your loved one receives the professional care and all the help that they need clinically. So we're going to try to understand just basically what a skilled nursing facility is and determine when it is necessary that you look at that type facility for your loved one. First of all, what is a skilled nursing facility? Well, the definition is it is a licensed facility providing 24/7 skilled nursing care for things like rehabilitation, for therapy, for assistance with daily living activities. It's different from an assisted living facility because skilled nursing facilities are for individuals with complex medical needs, chronic conditions, things that require skilled nursing on a regular basis. Post-surgical recovery, intensive nursing 24/7. We'll do another video really understanding the difference between an assisted living and a skilled nursing facility. But right now, there's two categories of residential stay in a skilled nursing facility. First of all, there's short-term. Secondly, there's long-term. First, short-term basically means that they're needing to come in for some rehabilitation. Maybe they've had some surgery, maybe they had a fall, maybe they're needing some IV antibiotics or anything for a short period of time. The goal is to get them stronger, get them moving forward, and get them back home as soon as possible. The other option is long-term care. This is for somebody whose health has declined so much that they're going to be staying with us for quite an extended time, possibly through end of life. One of the questions is, how do I know when it's time for my loved one to be considered for skilled nursing facility? Well, you'll know that they're now needing more care than you can provide at home. And it needs to be clinical care. It needs to be nursing care. It's unsafe for them at home. Maybe they're having frequent falls or they're wandering and going out and getting lost and things like that. My dad had that issue. Or maybe it's an inability to manage medications. Maybe they have other high medical needs, like they need constant monitoring for IV medications or wound care or breathing apparatus. And this just exceeds the skill of the family to provide for the loved one. It is possible that it's because the caregivers, those that have been trying to care for this person at home, have burned out. I see that very often. It takes an intense amount of work without any let up to care for somebody with these needs at home. People try as long as they can, and quite often they come to me saying, I'm just burned out now. Maybe it's simply moving from a place, from understanding that we can no longer take care of them. We need to find a place where they can be cared for and they're safe. So if you've come to that point, one of the other questions is, how does this get paid for? Well, there are a number of ways. We will deal with that more extensively at a later time, but right now, just a quick overview is you need insurance because it's very expensive to private pay. It's going to be anywhere, I've seen anywhere between $6,000 to $9,000 a month for private pay because it's 24-hour skilled nursing. So most of us are going to need insurance. First of all, there's Medicare insurance. Now, it's important you understand that Medicare is designed for short-term care. It's designed for people who need skilled nursing and therapy or antibiotics or nursing care, and it is designed to only last for short term. And there's a couple of different kinds of Medicare. There's what we call traditional Medicare, If you have that, then they're required to have 3 midnights consecutively in a hospital before Medicare will pay for their rehab in a skilled nursing facility. Now, maybe you don't have traditional Medicare. Maybe you have Blue Cross Blue Shield or Humana or Presbyterian or one of the other named companies. In order for them to be able to come into a skilled nursing facility, they're going to have authorization by their insurance that says, we believe they need this care and we will cover the cost for it. We will help do that from the facility side once we have the referral from your doctor. Now, how long do they stay there? With short-term care, it will be up to the need and the progress that we see in the patient. Your traditional Medicare usually gives you 90 to 100 days, and your managed care, that's the Blue Cross Blue Shield, Presbyterian, Humana, things like that, that's determined by the insurance company. They keep updated on the progress of your loved one, and if they say, you know, he's really reached a point that he can't progress anymore, then they let us know that there are so many days left in his care, and you will be updated on that. I've already talked about the possibility of private pay, how it is quite expensive. There's also one other item called Medicaid pending, or MedPending for short. This is a time when a patient can enter the facility once he's been approved clinically. And then during that time in the facility will help them get approved for Medicaid. And Medicaid is long-term payment. Now, there's a lot that has to happen for you to qualify for Medicaid pending. Please watch the video on Medicaid pending if you want to know exactly how that works. So how do you make this transition? Once you know that your loved one needs to go into a skilled nursing facility, you need to be able to have some very open, honest talks with your loved one. Help them to understand that they are not giving up all their freedoms here, that they have rights and that they have choices and they have some control over their life. Help them to understand that if they want to come in for a trial basis for a month and give it a trial, we will all work with that. Set up a tour with the local facility. Any facility should allow you to come in and have somebody meet you and show you around the facility and answer questions and see the different activities that are available. Assure your loved one that you're going to visit them a lot. Most facilities allow you to visit all day long. In fact, they encourage you to come spend more time with them. Now, you can't stay overnight with them for insurance reasons and other things that make that impossible. And in many cases, you can still pick them up and take them over to the grandkids' birthday party, take them out to lunch, take them for the park. You just need to set that up with your local facility so there's no misunderstandings and they don't know where that person was at the time. It's important that you understand, when it is time, this choice is not an act of abandonment. It's an act of care, of love, of trying to provide safety and good care and a better quality of life for your loved one. So, if you've got questions or comments, I would appreciate you putting them in the comments section. And please check out the rest of this site so you can see the many different things we're going to be talking about in the near future. Just hit that like button and subscribe. Thank you. Have a nice day.